Imagine this. You walk out one morning, maybe to your pasture, and one of your healthiest animals, gone. Just like that.
Yeah.
Fine hours before, no sign of a struggle. It's baffling and frankly heartbreaking.
It really is. And often the killer isn't something external, some predator you can see. Sometimes it's already inside the animal.
An invisible threat.
Yeah.
That's exactly what we're diving into today. Enterotoxemia. Welcome to the deep dive. Our mission today is to figure out how this bacterium, Clostridium perfringens, normally just part of the gut flora, can suddenly turn deadly.
Right. And we'll look specifically at how it played out differently in, say, camels as your llamas and alpacas compared to cervids like deer and elk. They seem similar, but the disease pattern, it's quite different.
And we're drawing on a lot of veterinary research and perspectives for this, looking at it comparatively.
Yeah, we are. And the first really key thing to grasp, I think, is that this isn't your typical bug that spreads animal to animal.
No.
No, it's an acute toxemia. It's really about management, about the conditions inside the animal changing.
Okay, so it's not catching it. It's more like conditions become right within the animal itself, like flipping a switch almost.
Exactly. That's a good way to put it.
So let's talk about this villain then. Clostridium perfringens. What is it normally?
Well, it's a bacterium, gram-positive, anaerobic meaning it thrives without oxygen, and it's everywhere. Soil, but also, crucially, it's a normal resident in the gut of most animals, humans too.
So it's just hanging out, usually.
Usually, yeah. Its numbers are kept in check by all the other microbes, the gut environment. It's all in balance.
Until it's not. What throws off that balance? What's the trigger?
The classic trigger, the big one, is a sudden flood of highly fermentable carbohydrates.
Sugars and starches, basically.
Exactly, things that break down really fast. When there's suddenly a ton of that fuel available, Clostridium perfringens just explodes. It multiplies incredibly rapidly.
And this rapid multiplication isn't the main problem itself, is it? It's what they produce.
Right. As they multiply like crazy, they start churning out potent toxins. Really nasty stuff. Alpha, beta, epsilon, iota. Different types produce different combos.
And these toxins, what do they actually do?
They do major damage. First, they attack the intestinal lining, causing tissue death necrosis.
Oh, wow.
Yeah, and they also make blood vessels leaky, so toxins escape the gut, get absorbed into the bloodstream.
And that leads to system-wide problems.
Systemic toxemia, shock, and often very, very rapid death. It's a cascade.
Okay, devastating. Let's zoom in on our first group then. Camelids, llamas, alpacas. How does enterotoxemia look in them? Is it different?
It is somewhat distinct, yes. It affects both young ones, crias, and adults, and while diet can be involved in camelids, it's often strongly linked to other underlying health issues, things that weaken the gut's defenses first.
So less about just pure overeating, more about vulnerability.
Often, yes. A really significant factor in camelids is co-infection with a specific coccidium parasite, Eimeria macusaniensis.
Coccidiosis.
Exactly. EMAC, as it's often called. It causes pretty severe damage to the intestinal lining itself.
Creating the perfect environment for the Clostridium to take hold.
Precisely. Other things matter too, of course. Sudden feed changes, especially high protein or carbs. Stress is a big one. Bad weather, transport, social stress.
And you mentioned age.
Yeah, crias, the young ones, are definitely more susceptible. Neonates, brand new babies, are particularly vulnerable to type C Clostridium perfringens.
Okay, so if an owner suspects this, what signs might they see? Assuming they even see signs.
That's the tough part. Often it's peracute, meaning you just find the animal dead. No warning.
Like our opening scenario.
Just like that. But if you do catch it, you might see severe depression, just listless. Signs of shock. Colic abdominal pain, maybe bloating, a fever.
Any diarrhea.
If they survive more than, say, 12 hours, you might see really foul-smelling or even bloody diarrhea. And sometimes neurological signs, tremors, seizures, that arched-back posture called opus tautonos.
Sounds awful. Diagnosing it in a live animal must be incredibly hard then.
Very hard. Antemortem diagnosis is usually presumptive. You might suspect it based on the signs and history, but ruling out other acute conditions is tricky without definitive proof.
Which comes from?
Postmortem. Necropsy is really crucial.
What do you find there?
You'll typically see sections of the intestine, especially the jejunum and ileum, that are hemorrhagic and necrotic, basically dead and bloody.
Okay.
And congestion in organs like the liver, kidneys, lungs. Confirmation involves actually isolating the Clostridium and, ideally, detecting its toxins in the gut contents.
Given how fast this moves, I imagine treatment is often too late.
Often, yes. It's frequently unrewarding. If you catch it very early, you might try aggressive treatment, high doses of antibiotics like penicillin, maybe antitoxin if you can get the right type C and D antitoxin
So
quickly.
neutralize the circulating toxins.
Right. Plus intensive supportive care fluids, pain relief. But the odds aren't great when signs are severe.
So it really circles back to prevention for camelids.
Absolutely. Prevention is paramount.
What does that look like?
Number one, a solid vaccination program using those multivalent clostridial vaccines, usually covering types C and D.
Especially for the young ones.
Definitely.
Yeah.
And vaccinating pregnant females about a month before they give birth is key. That passes immunity to the scoria through the colostrum, that first milk.
Okay. Vaccines. What else? Given the parasite link.
Exactly. Rigorous parasite control is vital. Monitoring fecal samples, strategic deworming, especially targeting Eimeria macusiniensis.
And diet.
Careful nutritional management. Avoid abrupt feed changes. Keep diets well balanced. Basically support overall gut health.
So for camelids, the prognosis is generally pretty guarded if they get sick.
Very guarded, yes. Poor in those peracute or acute cases. Maybe slightly better if it's a mild or subacute form and you jump on it immediately. But prevention is really where the focus has to be.
Okay, that's a clear picture for camelids. Now let's shift gears to cervids, farm deer, and elk. How does enterotoxemia manifest in them? Is it the same beast?
It's a related beast, but it behaves quite differently. In farm deer and elk, enterotoxemia is often a major herd problem and is almost always linked directly to diet.
Ah, okay.
So much so, it often gets called overeating disease. It's a leading cause of sudden death, especially in well-conditioned animals.
Overeating disease, that's telling. So what's the specific dietary issue?
It's that sudden hit of highly fermentable carbohydrates again, but it's even more pronounced here. Typically, it's grain, corn, barley pelleted feeds.
Things deer aren't really designed to eat in large amounts.
Exactly. Their rumen, their digestive system, just isn't adapted for huge loads of grain. Switching them suddenly from forage or browse onto a high-grain diet, that can be absolutely lethal.
And you said it hits the best animals.
Often, yes. The fastest-growing ones, the ones in prime condition, it seems counterintuitive, but they might be the ones eating the most aggressively. Young animals are also very susceptible.
And any other factors? Stress?
Stress definitely plays a role too. Transport stress, sudden weather changes, overcrowding these can push animals over the edge if the dietary conditions are already risky.
And the signs. Is it also that sudden death picture?
Very much so. That's the most common presentation. Found dead, good body condition, no warning.
Just like you said at the start. Yeah.
If you happen to see signs, they're usually acute and severe. Often neurological convulsions, staggering, circling, incoordination. Severe depression, colic, maybe that greenish or bloody diarrhea, but often you just find them gone.
Which means treatment is basically off the table.
Pretty much. It's so rapid. Diagnosis is almost entirely a postmortem affair. You need a fresh carcass to get good information.
Okay, so what are those classic postmortem signs in deer and elk? You mentioned they're quite distinct.
They are. The term bloody gut gets used a lot. You'll see segments of the small intestine that are intensely hemorrhagic, dark red, almost black, filled with bloody fluid. Another classic finding is fluid accumulation. Excess clear or yellowish fluid around the heart, that's hydropericardium, and in the chest cavity, hydrothorax.
Okay.
And then there's the pulpy kidney, especially associated with C. perfringens type D. The epsilon toxin it produces causes the kidneys to break down incredibly fast after death, making them soft and mushy.
Pulpy kidney. Got it.
You might also see tiny pinpoint hemorrhages, petechia, on the heart surface or other internal membranes. And like with camelids, you'd want to confirm by finding the toxin, usually epsilon toxin, in the gut contents.
Those are some vivid and quite specific signs. It sounds like if you see that pattern, enterotoxemia is high on the list.
Extremely high, especially with the history of potential grain access.
So again, with treatment being basically impossible, prevention is everything for cervids.
It's not just everything, it's practically the only thing. The absolute cornerstone is strict feed management, meaning avoid sudden introductions of high carbohydrate grains, period. If you must supplement with grain, the change has to be incredibly gradual. We're talking over weeks, allowing the rumen microbes time to adapt.
Okay, slow changes. What else? Vaccination.
Yes, vaccination is highly recommended. Using those same multivalent clostridial vaccines, just like for sheep or cattle, it's a very effective tool.
And minimizing stress, I assume?
Absolutely. Good handling, avoiding overcrowding, providing shelter.
Yeah.
All the standard good husbandry practices help reduce risk.
And the prognosis, if a deer or elk actually develop signs?
Extremely poor. Essentially hopeless once clinical signs are evident. The focus has to be on preventing it in the rest of the herd.
Okay, so we've looked at these two groups, camelids and cervids, and seen some real differences in how enterotoxemia plays out. Let's maybe just quickly summarize those key distinctions.
Sure. I think the biggest one is the primary risk factor.
Right.
For camelids, think parasites, Imuria mucosinensis, and underlying gut health issues. Maybe stress, sometimes diet. For cervids, think diet specifically. Sudden grain overload, it's almost always the main story there.
And how it looks clinically differs too. Camelids might be individual sick animals, sometimes showing signs before death. Cervids often multiple sudden deaths in previously healthy-looking animals.
And those necropsy findings give big clues, too. Hemorrhagic gut and organ congestion in camelids versus a really dramatic bloody gut, pulpy kidney, and fluid buildup in cervids.
Which points directly to different prevention strategies being key.
Exactly. For camelids, you're focusing heavily on vaccination and parasite control. For cervids, it's all about meticulous feed management and vaccination. You tailor the approach.
It really drives home how complex gut health is, doesn't it? And how much our management decisions, feeding, parasite control, stress, impact that delicate internal balance.
It absolutely does. You see how a seemingly small management change, like switching feed too quickly, can have utterly catastrophic consequences. Ecology, really.
Definitely. So wrapping up this deep dive, the big takeaway for me is that enterotoxemia serves as this stark reminder, doesn't it? That sometimes the most lethal threats aren't external, but internal. Waiting
for the right conditions, often triggered by us, by our management. And because treatment is so often futile, prevention really is the only reliable path. That means careful feeding, good vaccination protocols, managing stress, controlling parasites, meticulous care.
It really underscores the importance of understanding that relationship between the animal and its microbiome, which leaves me with a final thought for you, the listener.
Yeah.
Consider that intricate world inside the gut. We focused on Clostridium perfringens, but how many other potential issues might be lurking in that complex ecosystem, just waiting for the right internal environmental shift to emerge? What else don't we fully appreciate about the power of that internal balance?